This episode discusses heart disease, sleep apnea, and prescription medication interactions. There is no graphic content, but sensitive listeners may find discussions of sudden health crises concerning. She made galaxies sparkle. She delivered lines that became part of our collective imagination. She laughed, she wrote, she spoke truth to power, even in the face of personal demons. Yet behind the humor, the lights, and the iconic hairstyle, something quieter, something dangerous was happening. Something that could strike without warning. In December 2016, she was on a flight from London to Los Angeles. The plane landed safely. Friends, family, and fans expected her usual charm and wit at the next public appearance. But shortly after arrival, she suffered a massive cardiac arrest. It wasn't her first warning. For years, she had battled sleep apnea, which made her nights unsafe and strained her heart, prescription medication use, sometimes interacting in dangerous ways, underlying heart vulnerability from both genetics and lifestyle. Yet the public saw a vibrant, outspoken woman. Few realized that her medical story was quietly complicated. Sleep apnea is often underestimated. At night, the airway collapses, oxygen levels drop, and the heart struggles to compensate. Combined with prescription medications, many of which she used to manage pain, anxiety, and insomnia, the risks increase exponentially. Her heart finally reached a tipping point. In the emergency room, doctors battled to revive her. Friends described her as fighting her way back, but she lingered between life and death. She survived that night thanks to quick medical intervention, but it was a stark reminder. Even the strongest, funniest, and most iconic among us are not immune to hidden health threats. Few people know that she used her struggles to help others. Her honesty about mental health, addiction, and physical illness became part of her legacy. She authored books and screenplays detailing the human side of fame, depression, and medical vulnerability. She brought humor to tragedy and spoke truth to the stigma around mental and physical health. Her story reminds us that even the brightest stars may battle quietly with conditions that could become life threatening without awareness and care. The woman whose voice made us laugh, whose courage inspired generations, and whose struggles were often private was Carrie Fisher. Many knew her as Princess Leia, but her life was far more than just a role. Many knew her as Princess Leia, but her life was far more. Sleep apnea, heart disease, and medication interactions are more common than most realize. Her story encouraged doctors, patients, and the public to take these risks seriously. Even in the face of fame, humor, and resilience, the human body has vulnerabilities we must respect. But what matters most is the space in between, the moment when the story became human again. This has been Behind the Diagnosis, Famous Lives Untold. The life you knew until the diagnosis. Until next week, be well.